Welcome back to our fourth webinar in our series on PPACA and the updates for 2012. As I've reminded everyone on the prior three webinars, the material in this program was developed as of mid-September 2012. It's important to keep that in mind because I don't know at what date you'll be listening to this particular recording. What's important to recognize is that these webinars were developed before the political action of November, before whatever congressional changes occurred, before a whole host of regulatory guidelines that we expect to be released in December and early January have come out. Those new regulations will explain in excruciating detail some of the things we've been talking about in the last three webinars. In fact, it is possible that certain things we've been teaching actually get contradicted as regulations meet the reality and something has to give. The reason I'm mentioning that is, hopefully after January 1st, 2013, we'll be making new presentations in your market, or we may be doing live webinars, or perhaps we'll be doing new recordings for you to listen to at a later date. Either way, you'll want to stay in touch with your Ward & Brown sales representative so that you can be informed of when these new updates are available. This fourth and last course in our series, How to Advise an Employer About PPACA, has been built because many of our clients have been hearing a lot of noise on talk radio shows and TVs or in their Chamber of Commerce. The talk has been about some ethereal, mythical amount of money that an employer can save if he simply fires you as the agent and broker, drops his group health insurance, and sends all of his people to let the government cover them. For our purposes in this class today, I'm going to suggest that you have two imaginary buckets in your hand. On the left hand, your imaginary bucket is going to say what I call the illusionary savings that the employer thinks he's going to save dropping group health insurance. In your right hand, I'm going to have a bucket of the real costs that he hasn't thought about, but that this course will teach you about so you can explain it to him. To understand this illusionary idea of some big savings, take a look at the Kaiser Family Foundation chart that suggests the average premium an employer would pay for a single coverage policy in America would be $5,049. Well, if that employer decided to drop all coverage and simply pay the highest penalty possible, which would be $3,000, in theory, in his bucket in his left hand, he would have $2,049 in savings. Well, if the employer is smart enough to imagine those kinds of savings, what about the individual? An individual who simply says, I think I will go uncovered as an individual, well, his penalty in 2014 could be as low as $95 and as high as $695 in 2016. So he could save from $4,300 to $4,900 simply going uncovered. And he's being told, imagining that he can get coverage at any moment and all of his pre-existing conditions will be covered. But as we're going to see, both he and the employer are really not going to have the kinds of savings they imagine. They have to start with the first question, why would they buy coverage if they could save all this kind of money? Well, it starts off with how our employer-based health care is paid for in America. You see, in the Western industrial world, most health care is paid for by government. But in our situation, something unique occurred. Immediately after World War II, men like my father returned from war. Before the war, my dad was a tool and die maker. After the war, he came home, and my mother, who had been one of the Rosie the Riveters of that day and age, simply left the workplace where she had been working during the war effort, joined up with my dad, and got enormous government benefits. The benefits included very low-cost loans to go back to college, very low-cost loans or grants to buy homes. Thousands of men went to war, and not as many men came back. While they were at war, thousands of women went into the workplace and fulfilled the jobs, making the armaments, the bombers, the ships. Those men and women returned to the home place, not necessarily to the workplace. So as a result, immediately after the war, there was a huge race for workers. Men like Henry Ford, who had taken the River Rouge plant in Detroit, had been making cars and trucks before the war, almost overnight turned it into a bomber plant for the war. Other big industrialists, whether it be the Westinghouse of the world or the Flints or the Firestones of the world, moved their factories back into making the goods that would become the Industrial Revolution of the 1950s. But that meant they had to have workers, and there were a lot less men returning, and a lot less men returning from war and going back into the workplace. So as a result, like good industrialists, Henry Ford and Firestone and Westinghouse started upping the ante, trying to get as many men back into the workplace by paying more money. This inflationary cycle scared the Congress and the President to such a degree that shortly thereafter, Harry Truman signed the first wage and price controls in the history of our country. It basically did not allow the Fords and Westinghouse to pay additional wages. It also froze the price of things to try to keep things under control. But there's a funny part about government. It can only regulate that which it can think of, rather obviously, and it's not too creative in its thinking sometimes. Men and women, like you and I of the insurance distribution system, went to the Henry Fords of that day and said, Mr. Ford, you can't raise wages to get people to come work for you, but I've got something you can give them that isn't controlled by the wage and price law that the federal government had passed, and that's the very fringe benefits we sell today. Healthcare was one of the first things that started being offered by more and more industries as a way to attract employees and get around the wage and price controls. And you know, capitalism being what it is, the moment Mr. Ford decided to offer health insurance to everybody, well, then an insurance salesman like me went to Mr. Westinghouse and said, you know what Ford's doing to get employees? Health insurance. But if you only offer health insurance, it's only a tie. So to get your employees back, you got to offer some dental. Then, of course, somebody else went back to Ford and said, now you got to add dental. And by the way, pensions. Pensions are really something that will grab you more workers, and the race was on. In fact, the industry you work for today is a direct result of the introduction of fringe benefits, which was not regulated under the wage and price controls that Truman had signed. As a result, we are a work-based healthcare system. What we do is to provide health care through work. Now that may seem rather strange because you think you're in the business of providing health insurance. Actually, if you think about it, if it was cheaper for an employer to simply hire doctors and put them on staffs, then they would supply health care through work by having doctors that work in their company, the way Kaiser, metal, and shipbuilding, the foundries, construction companies did. The fact is, health insurance came to the fold because employers provide health care financed through work in the most efficient fashion, and the most efficient fashion to supply that health care is to have it paid for through health insurance. So we first got to get the mantra into our head that what our business is about and what the employer is doing, he's not so much giving health insurance to his employees, he's providing health care at work financed through health insurance. And he's doing that because instinctively knows that there is a very big difference in the type of employees who are attracted to that kind of strategy. I mean, think about it for a moment. If it was such a good idea to drop insurance, if this was such a good strategy, why does an employer have to wait until 2014 and the health care law goes into effect? Why not drop it tomorrow or yesterday? There's no law in place right now that says you can drop it. Why wait for PPACA to kick in? Obviously, the idea of dropping insurance only works if you currently don't have it. It sounds silly, but it's true. An employer who would drop his insurance will tell you quite bluntly, I can't do it, I'll lose my employees, or at the very least, he'll lose his good employees, and that's a fact. What PPACA does, in reality, it isn't there to cause an employer to drop insurance unless he doesn't understand the actual costs involved. It's there so that the guy who isn't offering is kicking something into the system. Why? If we have a sweatshop operation, hemming clothing or whatever they may be doing, on a factory under an overpass in LA, that gentleman may not have very good work conditions. The gentleman that owns that plant may not be paying adequate wages. He certainly is not giving benefits or any health care. But that doesn't mean his employees don't have health care. It just simply means that you, I, all your clients and everybody in America who buys health insurance is paying for his people to have health care, because all they have to do is go to the emergency room and they're guaranteed to get that coverage. PPACA simply says, well, if the rest of us are going to pay for this anyway, well, then let that employer pay something, $2,000 or $3,000, whatever it may be. But your employers, your clients, are already offering health care. And if you get them calmed down and away from the negative talk shows and out of the loud voices screaming at the Chamber of Commerce meetings, you discover that he understands intuitively health care offered at work financed through health insurance does in fact attract a different kind of worker. He does recruit and retain higher quality workers. That different type of worker is less mobile. He anticipates a long-term relationship, particularly if he's married and with children, or she is married and with children. I use my son as a perfectly good example. My son's in college. If he has a job, the purpose of the job is to get some immediate money. He has no more of a long-term commitment to a particular company that hires him at this point in his life than you and I did when we were young adults. But that employee who's attracted by fringe benefits, such as health care financed through health insurance, is going to be a lot less mobile. That's the kind of person that the small employer in particular will build his company on. Health care tends to work against job hopping. In addition, typically this type of employer is higher educated. Many times, employers don't realize it, what the cost of turnover is, and the cost of health care financed through health insurance is a lot lower than the cost of turnover. It's part of an employer's investment in human capital. I attended a Chamber of Commerce meeting recently in which an individual was there who owns a decent-sized gas station. And he was very adamant about the idea that he was going to drop all of his health insurance and save the money, just pay the penalty. Of course, in his case, he didn't realize he was too small. He wasn't going to pay a penalty anyway. So in reality, in his illusionary left-handed bucket, the money he's going to save is 100% of the premium. In his right bucket, the real cost for what it's going to cost him, he hadn't really thought about it. In the exchange from the podium that I had with him, I asked the gentleman how tough it was to run a gas station the way he ran it 7 days a week with the extended hours that he had, that it must be very difficult for him to personally sit there at the company for all those hours. Needless, of course, he thought I was from another planet as he described to me how silly that is, that he has key men that take care of opening the gas station early in the morning, closing the gas station late at night, and working all those extended weekend hours. I, of course, then asked him how easy it was going to be to replace those key men, because he wasn't willing to let any employee do those tasks. Imagine his problem if those best employees left him and he had to go out on the street and simply pick up another employee with no training and suddenly have them keep the cash and the till early in the morning or late at night. He had never considered the fact that he has investment in the human capital in those key guys that open and close his business. And part of the cost for him, if he lost them, would be he'd have to be down there those 7 days a week, those extended hours, or he'd have to cut back the hours within the gas station's operation until he could get somebody up to speed to do that. The problem with human capital, we can understand it, but it's hard to put a dollar figure on it, although frankly research has done that. We're going to show you some specific numbers, but what I'm going to suggest you have to learn to do is get the human story into these equations, because when the owner of the business starts to think about it, he can imagine a young person he's recently hired that he imagines, even though they're paying him very low wages now, as being somebody that will grow into the business, somebody who will help him grow that business over time. He's got other people that have particularly good skills. I recall very clearly 2 operations that fixed and repaired cars in a rural Illinois area. These body shops were on the east and west side of town. And while the example I give you is that of a 10-life employee, they didn't have 10 lives, but the example is reflective. In any given company, if you have 10 people, you probably have 2 people, and the owner knows it, that are probably better than him. In other words, they succeed despite him. There are probably two others at the bottom of the totem pole that you just keep around for the sheer bulk volume. And any employer would probably freely admit he'd like to get rid of the bottom two and get two more at the top. Well, in the story with the two body shops on the left and the east and west of town, one body shop, the two guys were absolutely expert and had a wide following in the area because of their ability to pinstripe and artistically decorate sheet metal, the cars and the trucks. People wanted the kind of work specifically came to that shop because of those two guys. On the opposite side of town, those two guys had a particular following because they could put a sheen on metal that was almost pearlescent. You'd look at that metal, it would almost look like as clear as the finest skin you'd ever seen. Just, I'm sure some of you have seen that type of metal work. Well, these guys didn't learn that quality of skill when they first came out of their trade school. They learned that by the employer investing in them and on-the-job training. If either of those two guys leave and go to the other shop, what's the value of that human capital that's been placed in those people? And of course, why would either of those two men leave? Because one of those two companies ended up putting in a small group health insurance plan. And the other company came out and found out about it because I went over there and told them. In other words, once you get one of two competitors in the marketplace with a benefit, the other one has to match it. It's very akin to that old adage that if you have only one lawyer in a small town, he's as poor as a church mouse. But as soon as you get two lawyers in town that can compete against each other, they both get rich. Well, that's the nature of human capital. It's a zero-sum game. The transfer of that capital goes to somebody else. So there is a real dollar cost. Probably the best example I can give you to close out this particular point is if you work in an agency and you have a really hard-nosed kind of owner that thinks that all his salesmen are just, absolutely the same. Watch what happens when his number one producer decides to go to another agency. That's when they suddenly call up people like Gordon Brown and want to know if non-compete agreements have any bearing in California. Owners know certain employees are worth more than other employees. That's just human nature. So we've got to put the story behind it and then put a price tag on what it's going to cost him if he turns around and loses that person. So what are the costs to an employer when employees don't have health insurance? Well, first, of course, if he has higher turnover, it means he has to hire more people and retrain more people. The turnover rate itself goes way up, as we're going to see from some studies. He has reduced productivity. There's no way a guy coming right into the office off the street can do the kind of productivity that the guy he just lost with experience. I'm going to show you studies that show there's increased absenteeism. And even when he has a very poor sick day policy, he's thinking he doesn't lose any money because he doesn't pay for sick days, absenteeism costs him in other ways. The number one way we're going to look at is presentism. That is, somebody who does not get health care financed through health insurance at work comes to work sick. They do not operate at 100% efficiency, and they make other people sick as well. That has a cost value to it. Finally, we've forgotten all about the worker comp costs that occur when you don't have health insurance. We've forgotten because since the 70s, more and more small groups have bought health insurance and seen their experience in workers' comp claims go down. Now, we know the dollar figures have gone up, but if you adjust for inflation, the actual experience levels have come down, and we've got some studies in this course to show you for that. So let's start with those studies. Here are 5 studies that deal with the cost associated with people working at companies that do not provide health care financed through health insurance. As you can see, this was a summation of studies done in 2003. A lot of times I get persons calling up and asking me for studies from last year that document this sort of thing, and I usually ask them for studies proving gravity documented last year. Because the fact of the matter is, in the studies that are done in this area, this is an accomplished fact. It is like gravity. People simply don't really study these things anymore because it's a given. If you don't have health insurance, for example, upper respiratory illnesses and absenteeisms increase. Provide health care financed through health insurance, you have 43% fewer days of sick leave in your workforce. The numbers of 286 to 1,475 per employee and the related work costs when they don't have medicine to handle manageable chronic conditions, those are from 1987. You can adjust them into today's dollars and they'll probably be about 3 times more. That's real cost that goes into the right-hand bucket that he doesn't understand he's going to lose if he drops the health insurance. Even a simple thing like the last study at the bottom, the 2001 study, a 10% drop in untreated pollen allergies in production due to untreated pollen allergies. We're talking about prescription medicines now. Why does the drop occur? Well, anybody who has allergies understands that if I can't get my medicine, it means I'm going into work with my eyes clouded up. If I'm doing data entry, I'm making more mistakes. If I'm doing court reporting, I'm transcribing things. If I'm working with my hands and eye coordination, I'm not as efficient with that, and in many cases, I'm actually causing injuries on the workplace, increasing workers' comp as well. These are real kinds of costs. Well, what about turnover? What's the cost of that? Well, the same study talked about in 2003 talked about the differences in turnover rates. The 1993 study that you're looking at shows 38% lower turnover rate on married men, 25% lower turnover rate in companies that provide health care financed through health insurance. The second study deals with the rates of turnovers with health care financed through health insurance and without anything, and as you can see, it's almost double the rate of turnover. Obviously, it also continues if you're supplying coverage for spouses and children. Well, if we can put a number such as $1,000 on the cost for turnover, and we can eliminate 38% of the turnover by supplying health care financed through health insurance at work, we can start to put a price tag at actual dollar costs into the bucket of costs you will incur if you drop health insurance. So there's a cost in finding the next employee, even if that's simply hiring a recruiter or doing it the old-fashioned way and putting ads in a newspaper. Although I'm not sure anybody hires on a newspaper anymore, but nonetheless, there's some kind of cost connected to it. There's obviously, if the employer has any sense at all, background checks and testing, and that costs money. There's cost of training the new employee. I don't care how simple the job is, somebody else has to be taken off their productive work, whether it's the employer or a supervisor to train the new guy, and then as the new guy is learning, his productivity is not as good as the old guy. So there's lower productivity as the new hire is integrated into the workforce. But what's the dollar value? Well, let's also not forget, before we look at the actual dollar value, the worker comp issue. These worker comp types of claims have really been going up like crazy in the last few years because of the amount of unemployment because of the recession. The 2011 U.S. Bureau of Labor Statistics analyzed new hire worker comp claims against experienced people. Why we're doing this is if the employer thinks there's no cost losing an experienced person, he's wrong. What money he thinks he saves on getting rid of health insurance premiums, he may suddenly discover he's paying it back in increased workers' comp. Because when he loses an employee and a new one comes on board, 13% of all worker comp claims in 2011 were the result of somebody in their first 90 days of hire. 13%. 23% of all those claims was in the first 4 hours of hire. At first, that sounds ridiculous until you think about the fact that current unemployment rates have many, many people, majority of them in fact, out of work for 18 months at a time. And those people are not going to the gym or standing on their feet or doing productive work. So when they show back up to work to either stand in place to do some job on a factory line, they've not been standing for 8 hours for a year and a half. Sometimes they've not been bending over, so even if they're in a desk or doing a secretarial, clerical type of job, the mere bending over and doing work in a file cabinet ends up spraining muscles, hurting ankles, or whatever it may be. According to the U.S. Bureau of Labor Statistics for 2011, employees with less than 1 year on the job account for 34% of all dollars spent on workers' comp claims. That is a huge additional risk when the guy says, I'll risk getting rid of my old employees and just hire new ones to replace them and save the money on the health insurance. Zurich, which is a private company, by the way, these statistics are published on the internet, and it's not just Zurich, there's lots of companies out there, and you can check the internet. Their statistics were even more eye-opening. On the private side, 43% of all dollars spent on workers' comp claims last year spent on hires with less than 90 days on the job. The employer who keeps replacing and loses employees because he thinks he's saving money getting rid of his health insurance will be turning around and spending it on his workers' comp. What other things? Well, obviously, supervisory time and energy has to be focused on a new hire. That has to be worth something. Physical skill sets or intellectual capital is transferred to a competitor. With that transfer, by the way, often goes business in the form of customers who prefer to work with people they know. And there are lots of customers who will follow a salesman or a support person or a service person or a skilled technician to a new company rather than stay with the old company. So what do we got? Let's put a price tag on it. The number one study in America that is well respected, is the most respected, is the Arizona State University Carey School of Business. They've taken everything we've just talked about and encapsulated into a dollar value. Mr. Employer, you may save $2,000, $3,000, $4,000, $5,000 dropping health insurance at your work, but the prediction is that that will cost you, for every person you lose, 150% of the person's base salary. So if you have an employee making $30,000, you drop health insurance, he leaves, that turnover is going to cost you $45,000. When I work with employers who say, I don't believe that 150% number, that's the real number. That's the one that should be sold because that's the truth. But if they don't, I then ask them, well, what do you think it'll be? Oh, it can't be more than 50. Fine. An employer saves $5,000 on the cost of health care through finance through health insurance, and by his own admission, if his cost is 50%, and he's got a $30,000 salaried person, that's a $15,000 cost. And we are really low-ending the average kinds of salaries in California. I would suggest the case could be that the average turnover in California probably costs the guy somewhere around $50,000 to $75,000, and his savings in health insurance premiums doesn't even come close to that. It's a misguided strategy to think that we can simply drop insurance. If that would be true, if the person could, if an employer could simply drop his group coverage and let the employee buy their own coverage, well, they could go about doing that today, yesterday, or tomorrow. They don't have to wait till 2014. But they know they're not going to do that because they know there are costs. By the way, many times an employer will tell me the reason I don't do that today is because I know they can't go buy their own coverage. Once the exchange comes in, they can go buy their own coverage. Yeah, but there's a little bit of problem on that. If an employer drops the health care at work and tells the guy to go buy his own coverage now that he can on a guaranteed issue basis, that's a pay cut. The employee has to be fairly silly or ignorant not to understand that he just got a pay cut. He's going to have to go buy his own health insurance through the exchange, even though it's guaranteed. And worse yet, he's going to have to do it with post-tax dollars. Well, considering that most employers, when they pay $1 in salary, it costs them about $1.25 concerning taxes and everything else, that guy will have to pay $1.25's worth of earnings in order to buy his own health insurance. That's a pretty big tax cut, and that's going to result, at least in the good people, going to look for another job. The employer is bound to keep the bad people because the bad people always seem to stay. Well, he could just say, I think I'll just ignore the risk of losing the employee and go back to the fact that he would be paying about 150% of the guy's base salary each time he loses one. Well, what if the employer did this? Because I've often heard this in Chamber of Commerce meetings. Once they understand the ramifications of the turnover, they then turn around and say, well, what I'll do is I'll increase the guy's salary or his hourly wage or whatever it may be in order to make him whole so he can go buy his own health insurance. At the very least, he'll be rid of me as a broker and all the hassles I bring him. Well, the first thing that has to be mentioned is the fact that in order to make the guy whole, his salary has to be increased more than just the cost of the insurance that he's going to purchase at the exchange. It has to be increased to post-tax dollars. That increases it. What the employer also seems to not recognize immediately is that when he pays people more money in salary, his employer taxes go up. His matches for Social Security, his Medicare, his FUTAs, SUTAs, WUTAs, and all those sorts of things. Again, he's now looking at probably somewhere around 140% in terms of additional salary or hourly costs by using the strategy, increase the pay, let him go buy his own. But it gets worse. As most of you probably already figured, every time I increase the hourly wage or the salary rate or the salary, that means workers' comp goes up, because workers' comp is directly connected to the amount of money being paid. I'm not even talking yet about the increased experience that's going to occur. The cost goes up just because the salary goes up. The employer also has loss on any Section 125 savings that might have been involved prior to him dropping the health care plan. But here's his real problem. He increases the salary, he gives the employee the money, and tells them to go buy their health insurance through the exchange. Why is the employee not just as clever as the employer? The employee is going to say to themselves at some point, wait a minute, I just got a big salary, and my penalty is $95 or 1% of my gross. The cost inside the exchange for insurance would be much more than that. Besides, doesn't the exchange have to take me and cover all pre-existing conditions? So I'll just wait till I get some sort of problem. Well, the problem with that, of course, is giving the guy the money and asking him to go make his own decision about buying health insurance means that you're almost promoting gaming the system. A young man like my son, give him that salary, tell him to go buy his own insurance. He's a young invincible. He'll use that money to pinstripe his car, put a new Dolby sound system in it. Who knows what he might do. But I guarantee he won't be buying health insurance through the exchange. Now, I'm being a little flippant in terms of my son. He's a good guy. But he is a young invincible. But think about the reality. The man who has a woman working for him, maybe she's got 2 kids, maybe she has a husband working, maybe not. But either way, they're in the same situation that a lot of people in Southern and Northern California are in. That is, they have a house that's underwater. Just making that house payment each month is a real chore. If I suddenly raise them $1,000 or $2,000 a month to go buy their own health insurance, I have a sneaky suspicion paying the mortgage every month is going to have a higher priority for that woman or that man. And they're going to use the same type of gaming system. I'll just wait till the last moment and buy my insurance when they absolutely need it. The problem with that is there's all sorts of indirect costs to the employer that he hasn't thought about when his employees don't use the salary increases and go buy their, or fail to go buy their own coverage. See, the employer can't force the person to go buy insurance through the exchange. That's where there's a great deal of misunderstanding out there. An employer can take his group and buy the shop, the small business exchange product, but that's like buying California Choice. The whole group moves in. He's simply buying it from a different carrier. The moment he drops his group health insurance, the shop is out of play. It's the individual exchange where the individual goes to buy their coverage, and he can't force them. He can't ask the exchange to give him a list bill and he'll pay the bill directly to the exchange. It doesn't work like that. And when the employee doesn't have health care given at work financed through health insurance, suddenly there are all sorts of costs that boomerang back on the employer that he has to understand. Well, we know it would be a mistake for the individual not to buy coverage. It would be like a person not employed today not having health insurance. Obviously, PPACA is going to require the purchase, but it's going to be done on a guaranteed issue on a no pre-X basis. But too many brokers and the general public think that what that means is I can go to the emergency room, and on my way to the emergency room, I can call up and get a policy. We know from the way the exchange will operate that even though it will be guaranteed issue and even though pre-X's will be covered, it is not going to be issued the next morning. It may be the first of the month after 30 days, or it may be only the 1st and the 15th, or whatever it may be. But the problem is the person can't get sick today and get coverage tomorrow. They can get coverage in some future tomorrow. But in the meantime, When does an individual who's going to game the system, really decide to buy health insurance? Not when he gets the flu or his kid gets the flu. He's going to make that decision when suddenly he's taken off to an emergency room, because suddenly he has a pre-existing condition worth covering. But his misunderstanding has resulted in him being taken to the emergency room without health insurance, so that even if he could get the policy the next day, the $55,000 that the emergency room care cost him the night before, that's his bill. The insurance doesn't cover that. They don't understand that. Their pre-X will be covered, not the bill they already ran up. And once an employee has that sort of bill, all sorts of things happen to that person in his family life and in his work life. In addition, emergency rooms do not qualify or are not even set up to do preventive or chronic care prior to the coverage starting. And of course, there is no RX. Well, let's look at that idea. What harm would it have to anybody if they had to wait to buy their coverage after they went to the emergency room? Well, one, of course, the bills already ran up and they owe that. But here's some statistics that need to be put into human terms for the employer who's thinking of dropping his coverage. 98,000 people a year, according to the Institute of Medicine, die from the most common errors in the ER. We're talking about the kind of error that if a person went into a nurse practitioner or a first-year medical student could be diagnosed within minutes. Those 98,000 people, a lot of people say to me, 98,000, I would think a lot more people die in the emergency room. Oh yeah, they do. But we're just talking about 98,000 people who die of the most common errors that could easily be caught if they had health insurance and went to a regular doctor. The reason for this is ER rooms are not set up to do common kinds of things. According to the Journal of the National Medical Association, when children are the patients in an ER, 54.4% of the patient's charts show one or more of the 15 most common errors. But that's where the children of the husband or the wife who doesn't use his salary increase to go buy health insurance because he thinks he's going to wait till the last moment. It's the rush to the emergency room where the problems start to occur, particularly in terms of the kids. How big a problem is the emergency room? Most owners haven't really thought about what it's like to have one of their employees stuck in the system because the system is clogged. It's obviously related to low income because today low-income people do not have health insurance, and so they end up clogging the emergency room. The 2010 Press-Garney study showed that the average wait time in California emergency room, 4 hours and 34 minutes, 27 minutes longer than the national average. And by the way, in case there was anyone mathematically challenged, if the average wait is 4 hours and 34 minutes, that means somebody got in the emergency room and waited no minutes. Gunshot wound to the brain, knife sticking through the throat, whatever it might be. And it means that the mom with the emergency room, which is perhaps her sick kids, they're waiting 9 hours. And if you want the worst of the situation, the average wait time in LA for USC's emergency room, one of the top in the country, by the way, the average wait is 15 hours. That means somebody's waiting 30. California, we have 7.1 emergency rooms per 1 million people compared to nationally. Nationally, there's 19.9 emergency rooms. So the employer in California who's pushing his people to go buy their own coverage and giving them an increase in salary is incurring all sorts of additional costs in which it is possible his people won't even buy the policy, but will wait till the last minute, game the system, end up in the emergency rooms. Well, what about your doctor of choice? You see, in a heavily managed care state like ours, your doctor is defined by the person on that list, the name on the list. We have 30% less ERs in California since 1990, and lots of specialty doctors are simply refusing to do emergency room work. In other words, 73% of the emergency rooms in California report inadequate on-call coverage by certain specialist physicians. This should come as no surprise once you read the data, but employers are not thinking about it. All they're thinking about is being angry at our industry because of the ever-increasing cost of health care and what a pain it is to deal with it, and gosh, wouldn't it be wonderful I just got rid of it and sent everybody to the government health care plan. Well, it's not so good. Fact is, in the ER, orthopedic surgeon, neurosurgeons, trauma surgeons, hand surgeons, OBGYN, neurologists, ophthalmologists, they're the ones least likely to be on call to come. I mean, think about it a second. An OBGYN doesn't get to magically waive his malpractice lawsuits because he's a nice guy and comes to the emergency room. When that OBGYN phone rings and the hospital administrator is asking him to come to the emergency room to take care of a last-minute maternity because the person doesn't have insurance, that OBGYN risks enormous lawsuits because he's never met the woman before, he has no idea of her prenatal care, what was involved, of her background. In fact, the situation is so bad that the OBGYN simply doesn't answer his phone. Well, the fact is, it's real hard to get the right kind of specialists to attend to an emergency room. So you have doctors trained in emergency room work, and that's not doctors looking for routine, common kinds of things. The quality of care in an emergency room, outwardly obvious things, stabbings, gun priorities, these all get much more priority versus severe pain or chronic issue. The most common errors of misdiagnosis, failure to diagnose, inappropriate follow-up, prescription errors, those go into the category of the 15. What about doctors of your choice? If an individual waits to the last moment, he games the system, he takes the salary increase, doesn't buy the coverage, how does he get the doctor of his choice? Because the fact of the matter is, when he then finally signs up for a plan, he's a new patient. And as most of us know who have done employment enrollments, even with the best of our system telling us that doctors' panels are opened, we often find them closed. And we have to go to our second choice, third choice, fourth choice. What will be like when everybody has a health insurance card in California and waits to the last minute to try to get onto a panel? Massachusetts is a perfect example of this. What's occurred in Massachusetts proved that payment source influences provider participation. So, for example, what I mean, carrier plans typically pay better, and hence, whether a carrier plan to the private or the open market, the doctor would still be contracted, but would he have an opening? 92% of the California doctors accept private insurance, 78% accept Medicare, 68% accept Medi-Cal. So there's whole regions of California where that young man who is going to be the up-and-coming person, the small employer is going to count on to help him grow his business, he's not making enough money now. He's going to be going to the Medi-Cal doctor, and in some areas, he may not have any doctor near him. But what else does the Massachusetts example and the national data suggest? Surveys are starting to be done about what's happening as more and more people come into the Medi-Cal system, and as more and more people will have an insurance card, but not necessarily a physician to take care of him. The AMED News, which is written by the American Medical Society, says that there's already a silent exodus going on in terms of medical doctors. Between 2008 and 2012, on a nationalized basis, doctors saw 16.6 fewer patients. And as you can see from the chart, less than half of the doctors plan in the next 3 years to continue running their practices as they currently run them. What that 16.6 fewer patients, that's like losing 44,000 doctors on a full-time basis nationally. Well, what did the Massachusetts Society find out when everybody suddenly became part of the exchange or part of the private care system in Massachusetts? Most of us have heard of owners of businesses who get very upset with us when the plan we sold them makes somebody wait, 5 days for a referral to a specialist. In Massachusetts, it doesn't matter what plan you're on, even a brand new privately marketed plan, because so many people are now getting health insurance in Massachusetts, the doctor's panel is simply filled up. He's not prepared to take new patients. In primary care in Massachusetts, these numbers are right out of the Massachusetts Medical Society. The average wait to get in to see an internal medicine doctor, if you're a new patient, is 48 days. If you're family medicine, 36 days. Pediatricians, 24 days. When it comes to specialists, you can see what's happening in all those areas. I've also put up for you the increase in just 1 year in the length of delay. What that small employer has to understand is if he drops health care, financed through health insurance at work, and takes the idea of giving his employees salary increases to let them go to buy their own. If they don't go buy their own and they game the system and wait to the last moment to buy it, knowing their pre-existing condition will be covered. California will have the same problem as Massachusetts. Those people with insurance will be on the doctor's list. Those people without will be new patients, and they will have to wait. The assumption why dropping coverage won't work is, even if you have no penalties, but first, for those people who will have penalties, their savings might be $2,000 or $3,000. But that money will be illusionary, even if their saving is the full value of the premium. It's going to be illusionary because unless you're willing to stick it to the employees, you're going to have to give them pay raises, including taxes. You have to increase your own taxes as a small employer to boot. You're going to have to increase in workers' comp and a loss of the Section 125 effect. The exchange, in terms of the exchange itself, if a person buys the coverage by using the salary increase from the employer, and the exchange costs go up next year, which certainly has been the experience of every health insurance plan I've ever sold, then isn't it logical the employee is going to come back to the employer and say, hey, my health insurance costs that you were paying for by raising my salary just went up. Give me a raise. Well, that simply means, particularly if he happens to be in a state that is poorly designed, we certainly do not hope that in California, but if a poorly designed state has an exchange that's not working, financial unviability of the exchange could become a real problem in terms of ever-increasing costs to those individuals in it. The premiums could also go up in the exchange if not properly run due to adverse selection. Right now, the employer has to effectively negotiate through his insurance broker or agent to try to find ways to save money on his health insurance premiums. But he can do that by changing designs and moving things around between what the employee pays and he pays. But once he sends those people to the exchange with a raise, they're going to be right back on top of him asking for more money to cover the increase, and he has no negotiation available. He can't ask them or make them change their benefit plan. He's really put himself into a tough spot. Also, the employer could end up losing control of his own plan. Too many people have failed to recognize participation under PPACA isn't a PPACA issue. It's still the carrier's issue. So that employer who decides he wants to give his poorest level people perhaps a ride to the state exchange with increased salary and keep his own people on the better plan that he has at work, he still has to meet participation requirements. And there doesn't seem to be any rational reason that I can think of where the carriers will simply throw away all their participation rules just because some guy wants to send part of his people off to an exchange. In other words, the employer and his employees he wants to keep on a group plan may end up being in the exchange as well. Well, the employer's non-premium problems are not going to diminish. What I mean by that is, right now he's thinking if he could get rid of you, me, and the uncooperative insurance company, that the complaints about people not getting to say referrals or complaints about claims not being paid will all go away. They're not going to go away. He just will have no input into them. People are going to be people at work. They're still going to complain about uncooperative matter, whether they're buying a personal policy through the exchange or having it through the employer. Depending upon the state's design, we don't want this in California, but we can envision some states where the employer will literally be sending employees to an exchange with an operational atmosphere of the post office. Not less complaints, more complaints. And of course, in every state, there's going to be problems for any employee who's going to be forced into the Medi-Cal or Medicaid system because that's the one where the least number of doctors participate. That young up-and-coming but low-paid employee who thinks of himself as an aspirational employee may not feel too well about being forced into the Medi-Cal program inside an exchange because that's what the law requires. Obviously, if the portal for eligibility finally gets built the way it's supposed to be built, which we talked about in the second course, anybody who's undocumented or fears any type of screening for IRS, those fears will come back to haunt everybody when the employer gives up his health care finance or health insurance at work and sends his people to the exchange. What about the employer endangering his own coverage? There's two types of coverage that are being endangered here. Of course, he could try to push undesirable employees to the exchange, but then his participation becomes a problem, as we've already talked about. He may himself decide to buy his own individual plan, and perhaps he wants to buy a better, more expensive plan out on the open market instead of going to the exchange. Private pools will no doubt become at some point a retreat for high-end individuals who can afford and want to buy individual coverage when they can't have their own group coverage. But if one thinks about it, high-end individuals are generally also the oldest individuals in the group. We may find a very odd reaction where very young and healthier people end up going to the exchanges and older, wealthier people end up taking private policy, individual policies, which means those rates outside in those policies eventually have to go higher simply because of the nature of the older risk that they're taking. We've got a few things we have to think about. One of them that I failed to mention and I want to pick up, and we have a few minutes left, is what happens when an employee chooses not to carry workers' comp and has some type of an injury over the weekend that can hold until he gets into work. We used to call this Monday morning claims. That is, a young man twists his ankle playing softball over the weekend. He doesn't have health insurance at work, so all he has to do is manage to get himself parked into the company parking lot and stumble as he goes across the front door of the work comp place and of the employer's place, and then that suddenly becomes a workers' comp claim. So not only is the employer paying more money to workers' comp because he's raised people's salary in the hopes they'll go buy insurance, his actual experience is going up as well as people basically game the system and take certain kinds of claims not to the emergency room but directly to the workplace in terms of worker comp. In many occasions, a small employer who thinks he's no longer paying for the employee's health care through the financing of health insurance is paying the employee's health care through the finance of workers' comp. He hasn't really saved a thing. What we've got to think about is we need to go back and look at the understanding about the math class that we took. This chart right here reflects the 9.5% on some very low-waged individuals. A person could keep his keep his health insurance group plan at work, and if the thing is getting too expensive, work towards changing it around how much each employee is paying through their own payroll deduction, because there's a fair amount of money that could be done through a 9.5%. This 9.5% affordability is, again, going to be based on the employee's earning. And, of course, if you remember, the penalties are kicked off if the employee can go to the exchange and get a premium tax credit. So something could be done there to help the employer's issue. Keep in mind, we also mentioned in the very first presentation that discrimination testing will be coming down the track. So an employer with, say, 20 employees, we know he will not be eligible for the penalties. So of the $2,000 or $3,000. So he's thinking he might save all $5,000 on average of the premium. But as we tried to show you here, the 150% cost on turnover that the Arizona State University study shows, and the various other costs of raising pay to substitute for dropping health care, the varying matching costs that occur there, I don't think he's going to be saving money at all. It'll probably cost him more. But worse yet, if he pushes some people to the exchange and keeps other employees, himself, his key people, perhaps family members, on their group health insurance at his work, at some point his company, no matter how small it is, this doesn't apply to large or small, every company would be involved in discrimination testing. And he could end up being fined $100 a day per employee for every day this discrimination occurs during the year. That fine alone could be more than what he would be paying for health insurance for every one of those employees. So what's our conclusion? Well, we need to think about going back to the future. In the 1970s, people like you and I started selling small group health insurance, and what we were selling was Why does an employer want to provide health care at work financed through health insurance? A lot of us have gotten lazy over the years and have discovered that selling health insurance is really just nothing more than spreadsheeting, finding a way to get the guy to buy the lowest priced product, completely forgetting to reinforce why he started buying health care at the very beginning. What we need to do is go back to the future and start reminding him about why you provide health care at work in order to keep employees, good employees, and in order to reduce turnover and to avoid the illusion of saving money because you dropped the health care coverage. Because even if the penalty is zero, the additional cost for anything else, the hidden cost for losing employees, is going to be much, much greater than the illusionary cost of dropping the health insurance. Finally, we have to make him understand that if he's going to drop the health insurance and doesn't want to lose employees, he's going to have to come up with some strategy to raise salaries so the employees can buy their own, and there's a whole host of associated costs with that. Even the higher costs, the lost productivity, the higher workers' comp, any loss of control that he might have, he can take care of his own future and can control things and negotiate, have you negotiate with a carrier in order to come up with solutions that keep people's health care financed through health insurance at work. He has to set aside some of the loud voices and some of the complaints. He has to understand the nature of the illusionary savings that he might have. Most importantly, you have to go out and believe it, because here's why. The guy running a sweatshop in a factory underneath the Los Angeles freeway overpass, he's not your customer today. He won't be your customer in 2014. If the government can get that employer to pay $2,000 to $3,000 per employee to help finance some of the costs that right now the rest of us are paying in the premiums that we currently pay for our own health insurance and our clients pay for their health insurance. So if those penalties can help reduce some of that cost, good. Your employer, the one you currently have covered, he had a reason for paying for that plan yesterday. He had it today. He's going to have it tomorrow. 2014 doesn't change any of those reasons. In fact, 2014 puts it in stark perspective how much he will be losing in other kinds of costs if he decides to drop and let his employees go somewhere else. But you've got to be out there selling that message now. If you wait until December 15th, 2013, it's going to be a little late to tell those human stories as to what really happens when a guy drops the insurance, hopes that his employees will go buy their own care, ends up in emergency rooms, end up with long waits to get a new doctor when they finally do provide the thing, and talk about those stories from Massachusetts to make him understand that as well. You've got a story to tell, and we're going to help you continue to tell that story as we come back out with more information and more explanations of regulations after the first of the year 2013. So you will look forward to you either attending one of our future seminars in the market or listening to a recording or a live presentation on the webinar. In the meantime, have a good rest of 2012. Keep selling.